Hello, I'm Daniel XIBILLÉ and I'm the Chief of Internal Medicine of the Hospital General de Cuernavaca. Today we're presenting a hospital-based cohort of patients with COVID-19 in the state of Morelos, Mexico. So everybody knows by this time that COVID-19 is caused by a beta coronavirus called SARS-CoV-2, and it's rapidly developed into a global pandemic in the space of 1 year, since December 2019. So nucleic acid testing is probably the standard method worldwide to detect viral infections, but this method has reportedly low sensitivity and specificity. In order to increase the sensitivity and specificity of COVID-19 and improve the diagnosis worldwide, a clinical operational definition for each case was developed by Mexican health authorities and the World Health Organization. So using both, the objective of our study was to describe patient characteristics of those patients that are hospitalized in the internal medicine department of our hospital, which is a general hospital. A total of 372 patients were analyzed for this transversal study, and we detected SARS-CoV-2 using the nucleic acid test. And the clinical data was also collected and analyzed upon each patient's hospitalization, according to the case definition. So most patients were male. 70% were hospitalized more than 24 hours after the onset of symptoms. They all had lower respiratory symptoms, and the most common symptoms that accompanied these lower respiratory symptoms were fever, cough, and dyspnea. Our findings have shown that patients who developed severe illness that merited hospitalization and, in some cases, assisted mechanical ventilation had a high mortality rate. And this was due to several effects or several events. One of them was the late hospitalization and the late assisted mechanical ventilation. So in many cases, physicians would wait until the patient had severe symptoms before intubating them or putting them on AMV. Most of the patients received standard treatment. Most received steroids. After health authorities showed that ivermectin and antimalarials were not useful, we stopped using them. Currently, we're using dexamethasone as a standard of treatment regarding pharmacological interventions, but we're also using pronation and all of the mechanical ventilation assistance that we can. We've used tocilizumab in only 12 patients and baricitinib in 26 patients. Baricitinib patients tend to do better, but no statistical significance is found when comparing the outcomes of death and or discharge. So the combination, we discovered that the combination of an RT-PCR and the clinical operational case definition showed a good level of correlation. So the clinical data captured by our instrument is pretty good and allows us to discriminate from patients that do not have an infection by SARS-CoV-2. These clinically based instruments are fundamental and very useful as diagnosis tools in guiding hospitalization and treatment of COVID-19 patients, and we think that we should develop them further in order to improve patient care. Thank you very much.